People have known about high-altitude headaches since the time of the Chen dynasty over 2,000 years ago, yet there is still no agreement on how acute mountain sickness is diagnosed, so our research is trying to determine if the AMS definition used will alter the association between AMS and inflammation. Acute mountain sickness is a debilitating condition that occurs when individuals go too high in altitude too quickly. The incidence of acute mountain sickness in literature is variable, but the main idea is that the higher and/or faster you go to altitude, the more likely you are to get it. Studies have shown that there are increases in inflammation when we go to altitude, and a few studies have shown an increase in inflammation in subjects who develop acute mountain sickness compared to those who do not. We hypothesized that the definition of AMS used would alter the relationship between inflammation and AMS. To do this study, we tested 34 men and women in the environmental evidence chamber with conditions simulating 15,600 feet with oxygen at 11.5%. While in the chamber, plasma samples were taken and acute mountain sickness scores were collected using the Lake Louise scoring system and the environmental symptoms questionnaire. A 13-plex human inflammation panel was used to measure the concentration of 13 inflammatory markers in the samples. We looked at 5 different AMS definitions that used either the Lake Louise scoring system or both the Lake Louise scoring system and the environmental symptoms questionnaire. Additionally, some of the definitions required a headache for the subjects to be considered AMS positive. Table 1 compares the number of AMS negative and AMS positive participants for each of the 5 AMS definitions. Going from left to right across the table, the number of AMS positive participants increases and the number of AMS negative participants decreases. Figure 1 shows that AMS negative subjects significantly increase IL-8 concentration from baseline to 10 hours of high altitude exposure, while AMS positive subjects do not. This indicates that IL-8 may be important in reducing AMS susceptibility by the activation of neutrophils that IL-8 causes. Figure 2 shows that there is a significant increase in IL-1 beta concentration from baseline to 10 hours of hypoxia in all participants except for AMS positive participants for definitions 1, 3, and 5. IL-1 beta helps lymphocytes fight infections, so AMS negative subjects may have an additional protection during hypoxia. Finally, Figure 3 shows that AMS negative subjects had a significant increase in IL-33 concentration from baseline to 10 hours of hypoxia, only for definitions 3, 4, and 5, which indicates that IL-33 is not involved in altitude headaches. In conclusion, the AMS definition used may alter the observed relationships between AMS and systemic inflammation. Special thanks to the Department of Defense for funding this project.